This is not about spinal surgery, but Sue's asked a question which I have a personal interest in as well. She wants to know about the military covenant. Should we refer military or veteran patients to someone specific rather than their GP? You might have to explain what the covenant is to those who are not connected.
Yes, so it's a really interesting and timely question. The military covenant essentially reflects the promise that society will look after its serving personnel and veterans. And part of that it is medical care, but it extends beyond that. It's also trying to avoid things like homelessness, and people, once they leave the service, can get access to jobs, etc., aren't penalised for having served within the military. So should veterans be treated, or should serving personnel be treated by military medics? Not necessarily, but there are some advantages and disadvantages. And if your audience are not aware, there are two programs at the moment. One is called the VCHA, the Veterans Covenant Healthcare Alliance, and the VTN, the Veterans Trauma Network. There are two similar initiatives whereby hospitals sign up. They have to abide by a certain set of guidelines in terms of trying to identify that they're part of that to any people that come there that are veterans, signposting veteran services for them, and providing information that perhaps wouldn't be available to others. So it's sort of a signposting guiding service for veterans. And then within the Veterans Trauma Network, consultants who are aligned to it will be contacted about, for example, in my case, I was contacted about a patient who needed a cranioplasty, which is a metal plate that covers a hole in the skull. Needed revision surgery for that, and I was able to navigate the sort of the neurosurgical NHS landscape for them. So those are two initiatives that I would encourage your viewers, listeners to look at.
So they should look those up, and then they can point their patients in the direction of one or other of those trusts.
Exactly. I think that we give military doctors or military surgeons understand the roles that the people we're treating do. And so this is in the home base in the UK. We understand the roles that they do. So we're able to offer occupationally informed advice. And an example of how that's been relevant in my practice is that we've reduced the number of spinal fusions by quite a lot, because we recognised that it wasn't easy to continue on in service after having had a spinal fusion. So we, because of the disruption to the paraspinal muscles, because of adjacent segment disease, that kind of thing. So we were able to advise personnel earlier that perhaps there's a different way to treat this. So that's one example. On the other hand, we're still a small service. The British military and the Defence Medical Services are small, so we won't have all the expertise. So it shouldn't be exclusively treated by military. I think we offer benefits in some situations.